All right, folks, welcome back to Oral Surgery Insights. I'm Dr. Russ Lieblick, here with my partner in pediatric care,
Dr. Brandon Rehrer, as always. And today, we're tackling a topic that can make even the most seasoned parents a little uneasy: oral surgery for kids.
Seriously, even as surgeons, we get it. The thought of your little one having a procedure, even for something relatively routine, can make your heart do a little jig.
It's like you're handing over your most precious cargo, and you just want to be 100% sure everything's going to be okay. It's a natural instinct to be protective.
And that's exactly what we're here to unpack today. We'll explore the common reasons why kids might need oral surgery, what you should be asking your oral surgeon to get a clear picture of things, and how we handle those little patients of ours to make it as smooth and stress-free as possible.
We want to take some of the fear out of the equation and show parents that, in the right hands, skilled, experienced hands, oral surgery for kids can be a safe and effective way to address some pretty common problems. So Russ, let's start with the big question. What are some of the common reasons why a kid might need to see an oral surgeon? It's not just wisdom teeth, because those usually show up later.
Definitely not. Wisdom teeth are more of a teenage or young adult thing. In kids, we often see things like impacted teeth, especially canines. Those are the pointy ones, the fangs, and sometimes they get stuck and can't erupt properly. They get all jammed up in the bone.
Yeah, those canines can be stubborn little buggers. They're supposed to come in and take their place of honor, but sometimes they just refuse to cooperate. And if they stay impacted, they can cause all sorts of problems. Damage to other teeth, bone loss, even the formation of cysts. It's a real mess.
Then there are extra teeth, supernumerary teeth. It's like the mouth decided to throw a little party and invite some uninvited guests. The tooth production line went a little overboard.
The bonus round. But those extras can cause crowding, misalignment, eruption issues for the other teeth, etc. They can really throw a wrench into the development of the permanent dentition.
And we also deal with frenectomies, which is a fancy word for releasing a tongue tie or lip tie. It's a simple procedure, but it can make a huge difference in a kid's ability to speak clearly, eat comfortably, and in the case of tongue ties, even breastfeed effectively. It's amazing how such a small piece of tissue can cause so much trouble.
Right. And unfortunately, kids are kids, so accidents happen. Tooth extractions due to trauma or infection are another common reason we see them. A nasty fall on the playground, a sports injury. It can lead to a broken tooth that just can't be saved.
And then there are more complex situations like jaw or facial injuries. We're talking about broken jaws, fractured cheekbones, that kind of stuff. It's serious, but we're trained to handle it. We're the guys you call when it's more than just a simple boo-boo.
And let's not forget cleft lip and palate repair. That's a specialized area, but it's something oral surgeons are involved in, often as part of a multidisciplinary team, working alongside plastic surgeons, speech therapists, and other specialists. It's a real collaborative effort to give these kids the best possible start. So, we've laid out some of the reasons kids might need oral surgery, but we know parents often have more concerns than their kids do, and they often have a few common questions when they bring their child to see us.
You're spot on, Brandon, and it's totally understandable. Anesthesia and sedation are huge. Parents always want to know about the child's experience and how it's all handled.
It is, but the key is to reassure them that pediatric anesthesia is incredibly safe when administered by trained professionals. We're talking about specialists who have years of experience and training in this area. We use specialized techniques and monitoring to ensure their little ones are in good hands.
Yes, we've got strict protocols and procedures in place designed specifically for children to minimize risks and ensure their safety. We take this stuff seriously. As oral and maxillofacial surgeons, we're the only surgical specialty trained in anesthesia as part of our residency. We train alongside the anesthesiology residents. The other interesting part of our practice is that we tend to be a funnel for pediatric issues, so we do it all the time.
And then there's the worry about postoperative management. No parent wants to think about their kid in discomfort, even for a moment. Luckily, kids just do great.
They do. Of course, we're experts in management for these situations, but kids generally need little more than some ibuprofen and Tylenol. Even with procedures that, as adults, we think would be difficult, kids just breeze through it. We use a combination of local anesthesia to numb the area during the procedure and sedation to minimize anxiety. We're doing everything we can to make sure they have a good experience.
And we're not just talking about during the surgery. We also provide parents with clear, detailed instructions on how to manage eating and medications at home and what to expect during the recovery period. We want to equip them with the tools they need to help their child heal comfortably.
Which brings us to another biggie: recovery. Parents want to know how long it will take, what their kid will be able to do, and when things will get back to normal. They're often juggling school, activities, and a million other things.
And that's a fair question. Recovery time varies depending on the procedure, but we give parents a realistic timeline and detailed guidance on what to expect at each stage. We cover everything from diet to activity restrictions. The good news is that kids are usually good to resume their normal activities very quickly.
And finally, there's the fear of complications. It's natural to worry about things going wrong, even if the odds are low.
Totally. But it's important to emphasize that serious complications are rare when surgery is performed by a qualified oral surgeon. We're highly trained to handle these procedures safely and effectively. You know, Russ, at the end of the day, it's all about making the best decision for each individual child. There's no one-size-fits-all approach.
Absolutely, and that whole process starts with a thorough evaluation and consultation with an oral surgeon. We need to get a clear picture of the child's specific situation, their overall health, and the potential impact of the condition on their future development.
We'll look at the severity of the condition, how it's affecting their oral health and development, and what the potential long-term consequences are if it's left untreated. We're thinking about their future well-being.
And then, we carefully weigh the benefits of surgery against the potential risks. Is treatment going to prevent more serious problems down the road? For kids, these questions are usually fairly straightforward, but still need to be understood.
And crucially, we need to have an open and honest conversation with the parents. It's a shared decision-making process. We want them to feel heard, informed, and empowered to make the best choice for their child. So to recap, Russ, oral surgery for kids. It's not always a scary thing, right?
Not at all, Brandon. When performed by a qualified oral surgeon, it can be a safe and effective way to address a variety of oral health problems in children.
And it's vital for parents to remember that it's okay to ask questions, to voice their concerns, and to advocate for their child's needs. We're here to help them navigate this process.
We're committed to providing a positive surgical experience for both children and their parents. We want to make it as easy as possible for everyone involved.
That's right, because in the end, it's all about restoring their smiles and helping them thrive.